Studies show that nearly half of all adults have gum disease, but they don't even know it. Now, if you really want to get technical, you could make an argument that most people actually have gum disease, at least to a small, mild degree. Now, gum disease really starts with inflammation in your gums, but there are some subtle signs that indicate your gums are inflamed, and you might not even know about them. So in this video, I'm going to go over 10 signs of gum disease that you need to know about. Now, before I get into all those 10 signs, I do want you to know why it is so important to know about your gum disease and why it's important to address it. Because I said how it starts with inflammation, but it's because of these bacteria that build up in your mouth that are causing that inflammation. And when it's just starting off, it can start off as really, really mild. There's multiple stages to gum disease. The first stage is gingivitis, but a really mild form of gingivitis. This is a form where a lot of people tend to have, and it's not really a big deal in this stage, but gingivitis itself can get more severe as your gums get more inflamed. But gum disease can also go one step further and turn into something called periodontitis. Periodontitis is a very serious problem because now it doesn't just affect your gums, it also affects your bones or the support structures of your teeth, literally the structures that are holding your teeth in your jaw. If this gets really bad, then you could lose all of your teeth. So if you have some of these signs and you're concerned, it's very important that you make an appointment with your dentist and see what's going on. The first sign is bleeding. Bleeding when you're brushing or you're flossing. A lot of people think that bleeding gums is normal or that it must have been something that their dentist or their hygienist did wrong, which is causing the bleeding. But bleeding gums is never normal, and it's usually a sign of inflammation. Bleeding gums is actually the #1 indicator of inflamed gums that we have. Literally, when a dentist is going to check how inflamed your gums are, and when you see inflammation in the gums, that equals gum disease. Now, does it have to be gum disease? Could it be something else? Like, could it be like your tooth fractured or something like that? Yes, but regardless, bleeding in your mouth is not normal and you should definitely get it checked out. Now, bleeding itself isn't obvious. It's not always going to be an indicator of gum disease because in some people, they might not bleed. For example, smokers aren't going to really have bleeding gums as much because the smoking will constrict their blood vessels. But smoking at the same time makes it more likely that you're going to get gum disease. Just because you don't have bleeding gums, it still doesn't mean that you're in the clear. The second sign is if you have red or swollen gums. Now, healthy gums should be pink and firm. Depending on your race, your gums might be a different shade of pink. But if you see some redness or puffiness in your gums, this could signal gum disease and it could signal inflammation again. I would say this is the second most obvious sign. First thing we look for is bleeding. Second thing is we just look at the gums and see how red and puffy they look. The third sign is bad breath or halitosis. If your breath smells bad, even after brushing and flossing and rinsing it with your mouthwash or whatever, it could be a sign of some infection or a lot of inflammation in your gums. Or it could also be a sign that you just don't clean your tongue enough because a lot of times people, when they have bad breath, it's because they don't clean their tongue. Could also be a dry mouth. There could be other things as well. But regardless, if you have a persistent bad breath or foul odor in your mouth, you should definitely get that checked out. The fourth sign is gum sensitivity or tenderness. If your gums start to feel sore or uncomfortable to touch, pay attention to it. This could again mean some sort of infection or inflammation going on. Now, having inflamed gums could also make your teeth more sensitive, which brings us to number 5. If you have persistent tooth sensitivity or sensitivity to hot or cold and it just doesn't go away, this could be because of your gum disease. Now, this is partly because when you have inflammation in your gums, it tends to just make your teeth more sensitive in general, but also when you have gum disease, it's more likely that your roots are going to be exposed in your teeth. For example, if your gums start to pull back and expose the roots that are inside your teeth, your roots are basically like a channel to your nerve, and if your roots are exposed, your teeth are going to be more sensitive. And this actually brings us to number 6, which is gum recession. So if you ever notice that your teeth are starting to look longer than usual, or if it looks like your gums are pulling back, well, that could be exactly what's happening. Gum recession is when your gums literally pull back away from your teeth, and in turn, they expose the roots in your teeth. Now, this could be not from gum disease. It could be from a lot of things. It could be from a misaligned bite, if you're biting unevenly and that pressure is basically contributing to that gum recession. Could also be from you grinding your teeth and putting too much stress on your teeth and leading again to that gum recession. Could also be from you brushing super hard. If you're brushing super hard, you could be scraping your gums away and again causing gum recession. But it could also be from gum disease. Now, if it's from gum disease, this is a more advanced stage. This is when you start to transition to that periodontitis I was talking about. Because when you start to get bone loss in your teeth, when your bones start to pull away, your gums will follow. And when your gums follow, that's when you start to get this recession. Now, while we're talking more about periodontitis, I'm gonna go on to number 7, which is changes in your bite or the position of your teeth. Like I said before, when you have gum disease that gets so bad that it turns into periodontitis, this is when it starts to affect the support structures of your teeth. And when this happens, your teeth can actually shift. They can start drifting and moving back and forth because they're getting loose. They're not as tight in the mouth as they used to be. So if you notice subtle changes in the position of your teeth, or it feels like your teeth are shifting, again, this could be a sign of periodontitis. Now, I will mention that your teeth do tend to shift as you age. As you get older, your teeth tend to drift in and get more narrow. And this is because all the pressure that your cheeks and your lips put on your teeth, over time they tend to drift. But I'm not talking about that gradual shift over time. I'm talking about if you notice one day, like my teeth were not in this position, or they definitely have changed, or my bite feels different, you should definitely get this checked out. Now, while we're talking about moving teeth, number 8 is loose or wobbly teeth. Healthy teeth simply should not move. If yours do, this is a serious sign, and again, it's an indicator of periodontitis. Now, if your teeth are noticeably mobile or they're moving, this is a more advanced stage of periodontitis. And in this case, it needs very urgent treatment, or else you might end up losing all your teeth. Number 9 is having pus visible in between your gums. So if you have visible pus or discharge, it's basically an obvious sign of an infection. Now, like I said before, gum disease starts with inflammation, but as this progresses and gets worse, it can lead to an infection. And gum disease may not affect the whole mouth evenly. Just because your gums look healthy in one spot, but they look weird in one spot, it doesn't mean that you don't have gum disease. Sometimes gum disease is very aggressive in very localized spots and doesn't really affect other areas. Now, that being said, an infection in your mouth could be other things as well. It could not be gum related, it could be tooth related, could be from something else. But any sign of pus in the mouth needs to be addressed very, very quickly. Now, number 10, the last sign I have is if your gums are feeling detached. If you feel like your gums no longer fit snugly around your teeth, or it feels like your sulcus or the gums that surround your teeth are a little bit loose, you might have some deep pockets, because ideally those gums that surround your teeth should be really tight and attached to your teeth. Not like actually attached, like you should still be able to floss and get underneath them, but there should be some resistance there. If they're very, very loose and kind of wobbly, this is a sign that you have some deep pockets. Now, deeper pockets are caused by periodontal disease, or that periodontitis again that I was talking about. Now, what are these pockets that I'm talking about? So if you ever gone to get your cleaning, sometimes they might bring out something called the perioprobe. This is basically something to measure the sulcus, or the attachment of your gums around your teeth. Because the gums that surround your teeth aren't entirely attached to the teeth. There's actually a portion that surrounds the tooth called the sulcus. The sulcus is not attached to the tooth. And this is what the hygienist is measuring when they use that perioprobe. And the reason that we do these measurements is because we want these depths to be at a certain number, ideally between 1 to 3 millimeters. So if you ever hear them shouting like 1, 2, 3, 4, 5 while they're measuring your gums, this is what they're shouting to their assistant to enter into the computer. Once you get numbers that are beyond 3, this is the start of some advanced gum disease. So I always say, like, when you measure a 4 millimeter pocket, this is more of a warning sign where some action needs to be addressed. But once you get a depth of 5 or more, then this is a sign of periodontitis. Because now that you have these deeper pockets, there's more bacteria that are getting deeper around the teeth, and they're gonna start to eat away at this attachment more and more. And over time, these pockets can get deeper and deeper until your teeth get looser and looser and eventually fall out. So if you have any of these signs, it's very important to get them checked right away. And it's very important that you do that, because let's say that you don't care about your teeth. Even though that having this gum disease is the #1 cause of people getting dentures, let's say you don't care if you lose all your teeth or how your smile looks, it also affects the rest of your health. Gum disease, especially more advanced gum disease, is linked with serious health conditions like heart disease, diabetes, Alzheimer's, and more. Actually, I made other videos about how gum disease is linked with other diseases. And I'm putting that link in the description below if you want to learn more about that. So again, if you have one of these signs or if you are concerned, don't ignore it. Make sure you go right away, because you could not only be saving your teeth, you could also be preventing another disease. Thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Did you know that the position or the way that you're sleeping could be making your snoring or sleep apnea worse? It could even impact how much oxygen your brain is getting when you're sleeping. In this video, I'm going to talk about the best and also the worst positions for your airway health, how you're breathing when you're sleeping. I'm also going to talk about, if you do have some of these bad positions,